Morning. I'm Dr. Murali. I'm an orthopedic surgeon, owner of Hope Hospitals. I'll be talking to you about the advances in healthcare. I'd like to show you a few videos, very short ones.
My mother was being treated for malaria. After 10 days of hospitalization and no signs of improvement, a doctor told me that my mother had acquired an infection of the urinary tract. I was shocked, angry, and scared. She was now being treated for a disease that she did not have when she was admitted into the hospital. They also told me that such infections are resistant to regular antibiotics. My mother died of a hospital-acquired infection of the urinary tract.
There are 25 major industries, and all 25 major industries shamelessly copy ICT from the other industries to improve their services, but except one, the healthcare industry. 4 years back, I developed DRM Hope. Being a hospital owner and an orthopedic surgeon in Nagpur, which is the medical hub of central India, I was confronted with a lack of complete hospital management system, lack of electronic medical record system that I could access from anywhere, from any time, from my hospital. I was confronted with a lack of proper tracking system to reduce errors. I was challenged to create a solution to the many issues and challenges faced by my hospital. Remember, Nagpur caters to about 1 million population. Now, what is DRM Hope? DRM Hope is an enterprise level SaaS-based hospital information system. It is an open source, trusted technology. It integrates different information systems into one single efficient system. It can be accessed from anywhere, anytime, from any web-enabled device. It solves the problem inherent in hospitals where there is a network of multiple programs that are not compatible. It can integrate almost any type of services, systems, departments, processes, data, can even handle non-medical services and functions like security, maintenance, etc. And of course, it reduces medical errors and improves quality of care, like you see in this story. I and my team went from hospital to hospital to see how hospital-acquired infections were monitored. We visited 1,200-bedded private teaching hospital. The number of deaths happening in this hospital due to HAI was very high. They didn't have tools to analyze data, and if they did analyze, they did nothing. They were in a phase of analysis paralysis. Other challenges were purchasing, running, maintaining large IT infrastructure and resources. And intercommunication is difficult, poor internet connectivity, and obsolescence of an existing software. Here, DRM Hope made the difference. What we had for them was a unique, innovative solution to solve the basic healthcare needs of at a cost-competitive way in India that we can roll out to other parts of the world as well. There were these pain areas that we identified: low bandwidth, slow internet, equipment integration. Our painkiller was offline mode, which syncs later. Now here I'll show you how HAI could be prevented, hospital-acquired infections. The EMR, we start from the microbiology lab where we find out from where the trend is, from the OT, ICU, ward, and trace it to the healthcare worker on duty, take preventive corrective action, and do the root cause analysis. So what is the immediate compelling need? Like we have been discussing last 2 days, Ministry of Health has introduced a uniform system of maintenance of electronic medical records by the hospitals. That is definitely immediate compelling need. Then there is NABH. There are 25 out of 25,000 hospitals, maybe only about say 300 hospitals are accredited, which means that only 1% of the hospitals in India comply with the government norms to prevent HAI. The hospitals simply don't have the tools or technology as they are not affordable. The Indian government enacted the Clinical Establishment Act, made it compulsory for hospitals to comply with certain basic quality norms. Without these, hospitals cannot get business from ex-servicemen's organizations, CGHs, etc. The bottom line is that if they don't comply, they perish. And in India, we collect a lot of data, but this data is irrelevant if it is not analyzed. The tool is also necessary for any hospital thinking of medical tourism. Without NABH, they do not qualify. In the US market, there's an enforcement of meaningful use incentive, which has made it a requirement for the healthcare industry to maintain patient electronic medical records, offering practitioners a payment from the federal government to apply this in their day-to-day activity for improving the quality of patient care. We have commercialized, we have been piloting it for the last 3 years. Now it's been working very well in various hospitals. Various hardware compatibility is possible. Various hospitals have used it. So here, DRM, the hospitals just plug in and subscribe to the services on a per transaction basis. It's built on shared infrastructure and resources, and you pay as much as you use. Offline mode, there's no capex involved. It reduces the cost per transaction to about 1/10 of the cost of a legacy software, and it provides EMR, telemedicine platform, integrated wallet card technology, PC kiosk based and mobile based technology. So this is the difference between a SaaS model, where you pay as much as you use model, and a pay upfront model. So it's like renting a house. You subscribe to the service on a per transaction basis. There's no capex involved, whereas when you buy a legacy software, there's an exorbitant capex involved. There is no infrastructure. There's no, you don't need all these servers in your hospital. You don't need an army of software professionals. You reduce time. There's no installing, deploying, maintaining servers, upgrades, and versions are released by the providers. So this is how 2010 we started this journey, and today we are targeting 1,000-bedded hospitals, both in India and abroad. It's various awards that we have won. So we provide value additions to the patient's hospital experience, bringing the wow factor by providing these wow factors that I call, generating of unique privilege card, the QR code for each patient, retrieving hospital reports and discharge summaries by logging onto the hospital website, voice message reminders, online self-scheduling of appointments. Then you have Pizza Hut module for caller identification at the front office. Whereas innovation, smart rooms, language interpreters, support portal, the dashboard which is integrated in the application. We are the winner of the India Innovation Growth Program the last year and this year's eINDIA Awards, and the Best Innovation in Healthcare IT in the Healthcare Expansion India Summit. Our business and technology partners are globally FICCI, Stanford Business Graduate School, and IC Square, Lockheed Martin. We are HIPAA compliant, HL7 compliant. So we reduce cost, we reduce time, improve the quality, and maybe help reduce the deaths because of medical errors in hospitals. SaaS represents one of the highest levels of technological advancement in the evolution of healthcare industry, but a mindset shift is required. Reach for the cloud now, change before you have to.